Over coffee one morning, a colleague asked sociologist Dr. Cynthia Miller-Idris a question. What would it take? What would it take to create a national intervention to prevent youth from radicalizing into extremism? The increase in domestic violent extremism in recent years has been drastic and is one of the most significant threats to the security and well-being of people in the United States today. Young people are spending more time online than ever before, and unfortunately many are exposed to propaganda on social media and online forums that extremist groups use to radicalize them.
Political and religious extremism, supremacist ideologies, conspiracy theory culture, there are as many different pathways to radicalization as there are individuals.
Now, there was not that much evidence for how to address this evolving crisis and effectively prevent young people from going down a path toward violent extremism. But it was clear that the standard law enforcement approaches of surveillance and prosecution were not enough to prevent radicalization, especially in evolving online spaces.
On every measure that we have available, so plots foiled by the FBI, actual attacks, the lethality of those attacks, the numbers of mass shootings, the circulation of propaganda, hate crimes, we're breaking records in every category.
Dr. Miller-Idris was determined to find the best solution to her colleague's question, and she knew that she had to take a different approach. So, alongside media and communication specialist Dr. Brian Hughes, they developed the Polarization and Extremism Research and Innovation Lab, or PERIL. PERIL was founded upon the belief that extremist radicalization could be prevented and stopped early on, well before it became an issue that needed law enforcement intervention. They were determined to shift the field in a new direction and decided to take a preemptive public health approach to figure out how to prevent people from being persuaded by propaganda and conspiracy theories.
The field of preventing violent extremism has historically been dominated by law enforcement and security approaches. And PERIL is really different because we start from an upstream primary prevention approach with an aim of stopping people from becoming radicalized before they go down those rabbit holes.
The kind of issues that PERIL focuses on are too complicated and ethereal to use only one research method. To that end, we are a mixed methods research lab, which means we use quantitative data, qualitative interviews and focus groups, and we're an interdisciplinary lab, which means we have sociologists, anthropologists, psychologists, criminologists, youth educators, all studying radicalization and extremism.
PERIL takes a public health approach to this work. We think that communities understand their own needs best of all. And so what we do is we work with the communities to help connect them from those needs, from the problem that they identify, to the solution, to the successful outcome that they're trying to reach.
PERIL designs and tests tools and strategies to prevent hate, bias, and extremist radicalization, using evidence-based approaches and rigorous testing to ensure the effectiveness of all prevention strategies. PERIL is scaling up and creating paradigm-shifting initiatives to help local, national, and international communities.
Domestic violent extremism is the most pressing threat facing the homeland in the U.S.
We can't arrest our way out of this problem. We can't surveil our way out of this problem.
We need strategies to help people recognize and reject harmful online content, to know how to recognize warning signs in the lives of their own loved ones, and to get help when they need it.
To learn more about PERIL and see what steps you can take to help prevent extremism, visit perilresearch.com.
Optimistic, community-centered, courageous, integrity, evidence-based, and inclusive.
This is who we are. This is PERIL. And we're equipping communities with the tools for change.